Camp Conversations, the podcast where we speak to professionals on the front lines of life, primarily in caregiving roles, on the spark that brought them to their work and how they keep that spark alive. In the spirit of fairness, today I'm going to talk a little bit about the spark that brought me to my work and how I keep that spark alive. So my name, as you all know that have been listening to this podcast, is Dayna Haig-Conway. I began my professional career in outdoor education, and I would guide and lead groups primarily for young people that were struggling with behavioral challenges. And from there, I went into doing a behavior intervention specialty in training, and I learned about supporting youth with on the autism spectrum. And then I did a specialty in ADHD. I continued on to Teachers College, where I learned to teach primarily high school students, and my focus there was student services as well as geography, outdoor, and phys ed. And I again worked primarily with youth that were having challenges in standard school settings, that had diagnoses for autism, ADHD, neurodiversity. And I began realizing as I was teaching that most of the work that seemed most effective was not using applied behavioral analysis, which is what I was trained in behavior intervention. And for those of you that don't know what ABA is, and I also had training in CBT, which is cognitive behavior therapy, my personal and experiential thoughts on that would be when I was working within school settings, using these two directions, we were really responding to challenges and figuring out how to intervene reactively when children and youth were struggling. And so I found that we would make changes, and these were little things like we would notice the antecedent to a behavior, what was happening before a behavior, and then we would track what the behavior was, and then we would then change how we would respond to that behavior. And it really just didn't align with my core, which was believing that we are all coming to different environments like schools from somewhere, and sometimes those stories of where we're coming from need to be understood first before we can even take a stab at what the behavior is about. So this led me to go back to university, and I first did a graduate certificate in school and counseling psychology through the Workland School of Education at University of Calgary. And instead of completing a Master's of Education, I then switched after I got the certificate and did a Master's in counseling psychology, because I really wanted to understand how to talk to the children and youth and the families that I had begun supporting about what was going on outside of just the behavior. And so this led to a career change from teaching to school counseling. And then on the side, I was also doing youth care work and family support work. So I was getting really to see families both within the institutions and outside of the institutions. And this led me down a rabbit hole where I became fascinated with motivation research and needs research and resilience research. And in exploring all of these avenues through both my master's and after my master's as a personal education journey, I really began seeing this trend of the value in understanding people's needs first kind of like Maslow's hierarchy, where we need to understand whether people have their basic comfort needs or basic survival needs met before we can even get to the top of that pyramid. And I realized in so many of the cases that I reflected on in the past that I was working on, both inside and outside of the schools and even in my own life, I was kind of starting at the top of the pyramid instead of understanding what was going on at the bottom of the pyramid. This became especially true when I became a mother myself. I have 2 kids, and I realized that if I just jumped into always fixing my kids' behavior without understanding if they were hungry or tired, or if I even jumped in and fixing my own behavior, like if I wanted myself to go increase my motivation for going to the gym or eating healthy, I really had to understand which of my needs were unmet first. And this tagline filled my head of full from within. I had to make sure that I was full from within before I could add extra behavior changes that I wanted to make for myself. Same with my kids. I had to make sure they were full from within. And then this began to transfer to the families I was supporting and the children and youth I was supporting. Since leaving the school system, I have a private clinical practice where I work with people from all walks of life, from children to seniors, and we start here with this camp method where we focus on understanding and meeting our needs and understanding our values and how to triage those values and how to use those values as a decision-making tool in our life. The therapy that I most align with is acceptance and commitment therapy, which is all about aligning with our values. I also love understanding the narratives that people bring with them that tie into their behaviors. And so all of these different pieces are how I started to build the camp method for me, both personally and professionally. So I have a very diverse background. The spark that brought me into this work has always been my parents from a really young age were always, I don't know if they explicitly ever said this or they modeled it or how I absorbed this from them, but to leave people better after they've had the chance to meet you, to leave the world better for the next generation or for others. I'm from a very give back family. Like, it might make them blush to say this, but my parents would even rent the ice for our community, so kids that didn't have the opportunity to play hockey, obviously I'm Canadian, could come out and we'd just have big scrimmages and everyone would have an opportunity to play. So I've been exposed to this give back model my whole life, and it has really inspired me to do work, align work with that value of giving back. And so my work really does help me be full from within, and it trickles into my personal life, and I feel very inspired by what I do. At camp, I so badly want to spread the message that we need to understand the needs behind lack of motivation or lack of resilience, because I don't see a lack of resilience as they just haven't been exposed to enough challenges. I don't see that. My experience has not led me to believe that. I believe that there are some unmet needs, and when we meet those needs, we have more capacity to take on external challenges. And so at camp, I want to continue to spread this. I want more and more people to be educated and empowered on how to assess the needs to improve motivation, to heighten resilience. And to do this, we do have a coaching certification program now. And this program We have our first group of graduates finishing, and they are now educated, empowered, and supported to teach these workshops across Canada to improve motivation and resilience. And this can be for everyone, for improving motivation and resilience in children and youth, to employees, so there's not such a high turnover rate from burnout, to supporting people that are in caregiving roles and are feeling kind of at their capacity, and to supporting parents on how to utilize these tools with their own kids. And so our coaches are doing a really diverse group of workshops. They have very diverse target audiences with a focus on building motivation and resilience by using the CAMP framework to assess needs and understand which needs are unmet, that are impacting our motivation and resilience, and then working to meet those needs and teach people different strategies to meet those needs. Our give back method, my value for giving back, goes one step further, where we are now, for every nonprofit, for example, that hosts one of our workshops, they will receive 5% of the earnings back for their nonprofit, so they can keep doing the amazing work that they've been doing with different PAC groups at schools, the parent advisory councils. If they have us present to parents in the community about needs assessments and how to improve motivation and resilience, then they also will get 5% of that workshop back to their PAC, because we know PACs are always struggling for finances. Really giving back to the communities is at the heart of CAMP. If you are a nonprofit or a PAC group interested in being a part of this, please check out our website, send us an email at info@campmentalhealth.com so you can apply to have a workshop tailored to meet what the needs are in your community, and to receive that 5% back. All of our coaches in our group are really amazing. I think one of the best pieces of getting to do this work is the amazing people that I interact with, and that really keeps my spark alive. I definitely have moments where I start to face burnout. I am such a giver that sometimes I don't really notice that I've given too much until I have that day where I have no motivation to start a task, and I really know that that's a sign that I need to connect back with myself. I'm so spoiled in living in a very natural area, and so time outside is really important to me. And then another piece that helps me keep my spark alive is, instead of looking at my needs as siloed activities, individual-based activities, I look at how I can overlap them. And my one example of this, because I'm still in the phase of motherhood where my kids are quite young and quite needy, is I used to look at exercise as something that I had to do separately and independently. And sometimes I do, because I need the autonomy of doing it on my own and being away from them. But often I try and pair that with connection time with my family. So I think of things that we can do together. Sometimes that's tag, sometimes that's jumping on a trampoline, sometimes that's skiing or hiking a mountain together. And as much as possible, I'm very clear on what my needs are, and I try and create clear mind maps of how I can overlap those needs. I hope today you just get to listen to this very short podcast, know a little bit more about me. If there's anything in here that feels like it has inspired you to reach out, please connect with me directly, info@campmentalhealth.com. I'm also excited to hear more stories from more frontline workers. We have some really great ones lined up coming down the pipe. So stay tuned for next week's episode. And thank you again. If you have a moment, please follow us or share us on any social media channel. It really helps us get our give back message out there and gets more people learning to understand the needs behind challenging behavior, behind lack of motivation, behind resilience. And instead of doing what I did for so many years and jumping in too late at the problem, which is just on the surface, we want more and more people to understand there's a layer deeper. And if we jump in at that layer deeper, that needs base, then we'll have more sustainable support and we will improve the lives of more and more people. Thank you again for listening and talk to you next week.